All right, so we've got a really exciting call today. We're going to start a series of videos on everything you need to know about purchasing and setting up a walk-in tub, a sit-down tub, the difference between what those actually are. And we're going to have a panel discussion here with some experts in the industry. So as we get started, I want to introduce Miss Diane Walkwiak.
Close enough.
Walkwiak. Okay, thank you. Mr. Josh Gordon from Drive Medical and Mr. Peter Kozlowski, who combined experience, I think, between this whole panel is about 50 plus years of experience in the industry. And, before we get started, I do want to say that Drive Medical is one of the highest quality platforms and the highest levels of patient care. And so we're very honored to have these people on. We're very honored to be able to represent such a standalone product in the industry that's top of the line. And myself, Sean Callahan, AKA Mr. Hospital Bed, we deal with home care on a very high level for long-term care, patient care, and wound care. So this is really a great segue for us because we have a lot of people now in the industry that are coming to us and saying, hey, what is the best way to keep my mom at home? What's the best way to keep my dad at home? Long-term care facilities are now coming and saying, how do we offer a higher level of patient care? What is it that we can do to provide better outcomes for the people that are in our facilities? And so we're seeing a huge growth in this segment for walk-in tubs, patient care, and all these different things. And today we're going to get into a few things which are going to include the basic things that you're going to need to know. And this is going to be an ongoing series, but today we're going to try to get into safety features, comfort and design, and also the types of tubs. But before we get started, Josh, you brought up a really good point on a call we did a couple weeks ago where you said it was the bathroom and the bathing that were the two key elements that are really need to be solved for a family member or for people that are basically in a care facility. And the bathing part of it is really a big part of it. So, do you want to talk a little bit about that? And we'll segue into that. But it's the bathing and the bathroom. When you said that, that really rang true to me.
Y-
And I'd like you to follow up and maybe give us a little more
Yeah,
about that.
you talk about, two areas. Really, one is, the bedroom and sleeping, which Mr. Hospital Bed covers. But this, and that gives that independence on how they're comfortable while they're sleeping, right? And if you think about, what individuals go through, bathing is just as important, right? And it's all about that experience and its independence, whether it's sleeping, whether it's just being comfortable and more relaxed. And those two functions are really what predominantly individuals look at making those decisions to move into these facilities or overall replacing bathrooms or setting up homes for their loved ones, because we got to make sure everything's accessible, right? And so one of the things, Sean, I know there's companies out there that do these ramps for houses, right? I was just, thinking about that. And really, yes, you think about someone who's leaving a house and getting to a car, but they're not thinking about all the internal pieces that are happening there, of what bed they're sleeping in and how are they getting to that bathroom and what happens in that, experience. And so having the opportunity to really discuss, this experience for these individuals is really what we're trying to maximize and offer.
I
I
will say
love that.
that if
Go ahead, Peter.
bedding if bedding and bathing is the number one reason that they're moving into facilities, then accommodating that in the home is the number one way to keep them from going into facilities. So if you can solve that problem, then you can extend that home care and keep the loved ones at home.
We can keep mom, dad, husband, spouses. Peter, you also made a really good point on a previous call we did. You talked about how bathing is more than just cleaning. And that's a really important point also because, we're dealing a lot of times with people that have a lot of aches and pains, stiffness, soreness, arthritis, a lot of injuries. There's a lot of situations that immobilize people that require these types of pieces of equipment. And as somebody that also is in kind of the wellness industry, there's a lot to be said for, getting into a real nice hot tub at the end of the day, soaking and letting some of that inflammation and really having something to look forward to at the end of the day. And so, there's a lot of things that come into that. So if you're a prospective person out there that's got a mom or a dad, or you're running a long-term care facility and you're looking for ways to upgrade the patient experience and to separate yourself into providing higher levels of patient care, this is definitely going to be a series for you, because between all of us on a day-to-day basis, we're answering those questions for family members, loved ones, and we're trying to provide the solutions. And Diane, that's where you come in, because you're really the expert in this field. And our goal, like with anything, is to provide educational value so that people are making the right choices. And when they do start getting into this segmented part of the industry, they understand what they're going to look for. They're asking the right questions, and they're getting that knowledge that they need so that they're making that informed decision. So with that being said, let's jump in and let's talk about safety features. Or actually, even before that, we started off before the call, walk-in tubs and sit-down tubs, and everybody hears a lot of these terms, but break down what that is and break down the different kinds of tubs that are going to be kind of set up for different types of patient needs.
Okay, so when we talk about mom and dad and either keeping them at home or getting them into the proper environment for their needs today, we kind of talk, you brought it up. It's the activities of daily living, and the two key are the bedroom and the bath. Being able to dress themselves, making sure they can, feed themselves, make sure their hygiene is, accommodated, right? So we have walk-in tubs that are really designed to keep you in home as long as possible. These have low access, easy access. Healthcare tubs serve two purposes, not only for the individual, that your parents or a resident within that assisted living facility or a skilled nursing facility. It also is designed to assist for the caregiver. So we're addressing two individuals when we talk about accessible bathing in more of an institutional or a community environment, okay? Walk-in tubs, again, are more for the home. Now, some of the tubs we're going to talk about and look at today work great in the home. They just might not fit in the normal bathroom within a house. You might have to be more creative, and this type of equipment might be placed more in a spare bedroom or enclosing a porch, and allowing mom and dad to stay in that home together, say 5 more years, instead of either being separated or both having to move out of the home into a caregiver environment. So walk-in tubs, again, step in, low thresholds, smaller size, accommodate independent or family provided caregiving. The wife might help the husband, or the husband might help the wife. But I'm no longer stepping over that 15 to 18-inch high side of a bathtub to get my soak. And then that's not the worst part, not stepping in and over. It's when I am down in that reclined position in the base of that bathtub, how do I get myself back out now? And a side entry walk-in tub, both step in or sit and pivot in, accommodates that concern. I don't have to worry about that anymore. Yeah. So if you'll go to the next slide, we'll kind of look at some of the different safety features. Again, these 3 models, so standard safety features, I guess I can hit on that first. We talk about the different things. Number 1 being an anti-scald. That's critical in either environment, in the home or in a healthcare facility, is that you want that anti-scald. If by chance, for some reason, one of your water line bursts or something, you don't want someone seated in that bath with scalding water entering that bathtub. So it's going to automatically shut it off. It's not going to allow that. Built-in grab bars, again, to help you in and out, and also to use when you're positioning yourself within the bath to get into that comfortable position.
And I'll add something too, Diane.
Yeah.
As you're going through these features, you see a lot of companies today that sell these bath benches and transfer benches, and they sell grab bars separately. I always ask the question, that experience of independence, try it doing it on your own with all your functionality and not having those issues. It is a miserable experience to hold a shower hose and try and clean yourself, slide through a transfer bench, pull a curtain, all of these things, the wet floor. When you think about that ultimate experience and where you want to be for that 1 year, 3 year, 5 years, you really want to think about, obviously, the whole experience of it, and make sure that you're maximizing it, because there's other options out there, if anyone knew about them. And that's what we want to go through today, right?
Right.
And hey,
Right.
Josh, if you don't mind, you actually have a personal experience with that as well, because there was a situation where I think with a family member, somebody had gotten that, and then you realize, wow, there's still a lot more to this. There's still a lot more, like, because the shower chairs and some of that basic stuff, and it all looks well and good, but you bring up such a great point. Even though it looks all well and good and it might somewhat be functional, it's still very difficult to perform the features you need to clean yourself, and you're really not. It's still becoming a chore.
Yeah.
I guess it's still like it's not something you're looking forward to. It's something you have to do to maintain bodily comforts, but it's not like getting into a walk-in tub and sitting down and just getting into almost like a spa thing. And so that's the beauty of what we do, is not only do we work with people in the industry, but we all have our own families, and we're experiencing a lot of this stuff firsthand ourselves. And so you bring up a really great point, talking about that. So thank you for that.
Sure.
Diane, go ahead and we'll keep going there.
No, you're fine. You're fine. And again, in the design, that key lock handle, we use it on the outward swing, all of our outward swing bathtubs. So it's a simple grip handle, easy to move, easy to control, and easy to use. It doesn't take a lot of effort. So anyone can use it. Again, great for a caregiver, great for an individual. We talk about showering within the bathtub. And I agree. There's a difference between sitting in a shower and having someone assist you in that shower and not feeling a little more uncomfortable. You don't get the pleasures you get in the soak of a bathtub, even if someone's helping you. But the nice thing about the bathtub, let some of the features that can be added, like an air spa system that moves the water, that can actually do a lot of the cleansing for you. And so, those things are just really beneficial to the individual. The warmth of the water at night, can help you sleep. Like you said earlier, just the heat of the water can help, just you've been on your feet, your knees are sore, your joints are sore. As we age, that happens to all of us. And so again, you don't get some of those same type of comfort or relaxation, or even the dignity of the bath versus being hosed off in a shower if I'm not able to care for myself anymore. So it does add different levels there within. And then regardless of walk-in tubs or healthcare tubs, they are all certified and tested at the factory. And so they hit the highest plumbing and electrical codes. So it's a safe bathing experience.
Just to expand on letting the water do the work, obviously, as we age, our skin gets a lot thinner. So, this is a patient population that generally will be more prone to wound development, pressure wounds, things like that. So cleaning the wounds, or just preventing wounds from them not having to scrape their skin, and letting the water do the work. It's a more gentle but still effective bathing solution.
And just to add to, we've, from our side, we've seen, a lot of facilities that don't know what's out there, and what exists and the options. We've also seen a bunch where they have units and they're outdated, and what is the experience for mom and dad walking into a home if everything looks outdated, right? So that refresh look and the ability to bring new residents in is a big deal. And so, if you're thinking about those, we have a lot of options that could assist with that.
It's beautiful. Diane, with the thermostatic anti-scald mixing valve, a quick question. Do you have like an auto temp that you can set it for? So if the person is there in the tub on a daily basis and we know that they like this setting, do you have like an auto setting feature or something where you can go right to those settings and the person's going to get the exact same temperature every single time they jump in?
Yes. So like it's preset at the factories to a certain maximum temperature, and then and that's where it's set, and that can be adjusted to increase or decrease in case there are multiple individuals using that bathtub, right? So the adjustment's really simplistic and easy. But yeah, once you set it, the thing is, depending on where your water supply comes from, that's the key too, is how far away is your hot water heater, be it in a home or be it in a facility. You've got to have so much time to get the right mix coming out of that valve. And so, that's not a perfectly clear answer, but the answer is yes, it can be set, but you might have a wait time, and I always say, get your water to temp way before you get in that bathtub, right? But, before you sit down and close the door and start to fill it, bring it up to temp through the shower wand or through the tub fill, either one, and get it to what the temperature you want it. And then once you start filling, you're at the right temperature to get that comfortable bath.
Beautiful. The disinfecting system, I know we're moving into there, and that's really a key component of all these systems is the disinfectant. For me, once again, I feel like this is such a great educational process for me to learn, with my parents, now getting older, my mom. So talk to us about the disinfectant system, what that is and how that works.
Okay, so the disinfectant on all the Drive healthcare models has disinfecting standard. It's just a standard option. It's not an option, excuse me. It's a standard feature within the tub, just like the anti-scald and the grab bars. Okay, so it's locked within you can lock the cabinet, and when you open the cabinet, it has its own disinfecting wand, and that wand will pull a predetermined consistency of water. It goes through a DEMA valve, water and the disinfectant, and we'll pull that out. You spray the surface of the bath and you scrub it with the tub brush. You let it sit 10 minutes. That's kind of industry standard on disinfectant. If you don't use their disinfectant, you just follow the instructions on your disinfectant. It sits that set time, you rinse it, you put the hose back in the disinfecting cabinet, you shut it up, and you're ready for the next bath. That's critical in the healthcare side. We don't put it on the walk-in tubs in home. You're cleaning that bathtub just like you clean your bathtub at home currently. You're not so worried about the husband and the wife being in each other's bath, right? But you should start to think that when Joe down the hall from me has been in that bathtub, I want to make sure it's clean before I'm in that bathtub, right? And so that's critical in the healthcare. Also, Drive only offers soakers and air spa systems, and it's a closed loop air spa system. Each one of the jets within the air system has a check valve that will not allow water to go back in the lines. So historically, the old whirlpool systems that you used to find in facilities, there's bath water that sits in those in between baths that you cannot get in and clean and scrub. So that will re-enter the next bath. So by closing that off and knowing when I clean the surface of my jets and when I clean the surface of the tub, I am only blowing ambient air from the room, the same air I'm breathing, back into that bathtub. So after what we experienced with COVID and Legionnaire's disease and some of the different things that we see that go through these facilities, this is an excellent system for eliminating the spread within that bathtub, right?
That's great. Actually, Josh, that kind of goes back to what you were saying. As the technology keeps improving, there's times where you're saying, hey, it's time to upgrade. And those are the kind of features now that you're seeing that really come from, just time of use and going through and looking at the product and then re-engineering it and figuring out how to make it better. That to me is a huge point of cleaning out those areas and not letting that water from a previous bath linger in there. That actually from a cleanliness standpoint, it seems like that would be a huge benefit.
Yep. Yep. You want to talk about the seat, Diane?
Okay. So the seat on the bath is designed, and we have a picture that will come up a little bit later that you'll see this a little bit better. But there's a slight recline in the back of the seat, and the front of the seat pitches up just slightly, so it kind of nestles you in a very comfortable, relaxing position, as well as keeps you in that position as you're bathing. You're not going to feel that you're sliding off a seat. Some of the bathtubs you'll see out there in the marketplace, they're real square. And that's not as conducive to being able to, sit back, relax, let that warm water, flow. You're kind of tense. You're in that upright position. So it serves several purposes. Also, there's a perivoid. Again, we're thinking of individuals that are being cared for by others. And so that void allows the water and the bath additive or the body wash that's in the bath water to help clean that area of the body. Again, we talk about the tenderness of the skin. We eliminate that washcloth. We can let the water and the cleansers do that in the bath.
Okay.
I love that. The comfort level of being able to be in there, because ultimately you want to be able to relax when you're in the tub. And like you said, if you're pitched straight forward in an upright position, it's not comfortable. I mean, it's not something where you're going to be able to relax and kind of, enjoy more of the experience of that. So tell us about, go ahead, Josh.
No. I was going to say, I know you talked about the plumbing and certification regarding that, Diane. Can you just elaborate a little bit more? How that works for either home use or for facilities.
Yeah, it's probably not a requirement that anyone needs in a walk-in tub in a home. It's just something we as a manufacturer are committed to, right? In the healthcare side, there's a lot more plumbing codes and certification codes for those facilities as they're being built. And it's all around the safety of the resident and staff, right? And so we just take it and we do it on everything we manufacture in our bathing line of equipment. Why wouldn't we want the same certification that we would put in a healthcare institution that maybe does 30 baths a day, to be this, we want the same quality in your home, whether you're doing 1 or 2 baths. So it's an added bonus that you will not find with most manufacturers of walk-in tubs.
Talk to us about the handheld shower wand.
Okay, so we touched about this briefly. Now, let's say that we put in one of these units within the home and someone in your family still wants to be able to shower. Well, they can shower with the handheld shower wand if they don't want to take a bath, right? But they have the advantage, if they want, they can sit down and do that shower. But they're doing it themselves. It's self-contained in that walk-in tub environment. Also, let's say I've taken my soak, I've taken my bath. Now I want to shampoo my hair. I have an easy way to rinse my hair. I don't have to, make that a separate process. I'm not going to dunk my head probably into the footwell of the tub to rinse my hair, right? So I can rinse my hair with the shower wand. So it serves dual purposes there.
I love that. I'm on the cusp of wanting to just jump in right now because I know we kind of have a format of what we want to go through. But, Diane, I want to get into the types of walk-in tubs because for me, I think the first thing I need to do is identify what the need for me is going to be, right? And so you have some people that are mobile, that might be able to walk. You have some people that might be using a walker. You have some people that might be using a cane. And then you have people that are going to be brought in and out with the Hoyer lift. And there's going to be different ways that people are going to use these tubs. And if I'm starting the process, the first thing I want to know is, okay, mom's using a walker right now. What's going to be the best? Like, can we get into that next part of it? I know we're going to kind of skip a section and we'll go back to it, but I really want to, in this call, I want to know what are the types of walk-in tubs? What's the ideal scenario for the needs of that particular person? and what's going to be the ideal format or setup for them, because we've got walk-in tubs and then we've got the healthcare. We've got a couple different styles. So maybe what you could do next is we can start looking in and saying, if this is the type of patient use you're going to use, then this is probably what you're going to want. Can we kind of dive into that
Okay.
next?
So let's focus on this today. Let's focus on the outward swing tubs. Okay.
Oh,
Because if we break it into, let's break it into 6 categories. We're going to have a inward swing walk-in tub that you step in and out of.
okay.
We're going to have an outward swing walk-in tub that is more designed like these 3 tubs you're seeing here, where you sit and pivot. And this allows then, that not having to step over a threshold, not having to step on a wet surface. This allows me to pivot out of the tub when I'm ready to dry off. I can dry myself before I even stand up. Okay, all of our outward swing doors, with the exception of one, and we'll talk about that because it fits more on the walk-in tub side another day, but these 3 side entry outward swing tubs allow you, if you see on the Berkeley, there is the seat position that you actually can, when the door is open, you can sit and then pivot your legs in. And if this is in your home, you can do that, very easily. Again, it's the handle is the same. You close the door and you push down on the handle, and that will close the door. But these tubs are designed for assisted bathing, more so than independent bathing. And the reason I say that is we place the controls in an easy, accessible area of the bath for the caregiver. We also, so I'm at the front of the tub, my person is seated at this side of, say, the Berkeley, on where the seat is. I am looking at the resident the entire time through this whole process. I can walk them through what we're going to do, why we're doing it. I want them to be comfortable. I still want it to be that same relaxing, comfortable. Let's face it, this is a treat, in my opinion, because there are certain things as we age that, we lose a lot of our dignity. We lose a lot of our, that independence, or that feeling of independence, and, I can do anything, as we age, we lose some of that. So this can give them that feeling of, hey, this is a treat for me. I'm in a spa. They are spoiling me. It's not that I have to be taken care of. They're spoiling me. They're making me feel good. And be the son and daughter of the mother that they don't feel they can take care of anymore at home, right? They have to go and tour these facilities and decide, well, what's the best place for mom? Well, if I walk in and I see a nice looking bath in a beautiful room, and they tell me that, mom can get her hair done on Tuesday morning and she can have a spa bath on Monday, Wednesday, Friday. I mean, come on. Or, the other options that we've kind of talked about, where they don't get that sense of dignity. They don't get that sense of, boy, this is a treat. This is something special. So that's what we're trying to promote here. But as far as safety for these tubs, it's again, you sit, you pivot. If a caregiver's helping you, they might assist you in lifting your legs in if you're losing some of your lower strength in your lower extremities, right? Also, if you notice, the opening under these baths will allow for a Hoyer, a sit to stand, a sling, any of those type of lifting devices. Even on the Meramec, that has an accessible panel that can be removed. And then you still have that accessibility under there. So this will cover quite a spectrum of individuals, from people in your independent apartments all the way up into early entry skilled, where there's still, it's easy for the caregiver to bathe them in this environment, right? Sling lifts are designed for bathing. They have mesh sling lifts so that, again, is that comfort, easy to get them in and easy to get them out. And so, again, simplicity, safety, not just for the individual, but for the caregiver. And that's important too, today in our facilities where staffing can be a real issue. And so you want those items addressed during that process.
Yeah, and that brings up a great point because a lot of times it's a spouse, maybe it's the husband and the wife's helping to take care of the husband or vice versa, and you want to be able to provide, I think we all agree on one thing, and through the calls that we've had together, we all want to be able to provide something at the end of the day or the beginning of the day, something in these people's lives that gives them something really exciting to look forward to, and a good hot bath and a setup like this that's safe where you're getting all the comforts. And it's not about it, the bathing part of it's there, but there is that spa part of it that you've talked about where it's really an experience. Peter, you talked about it also. It's more than just cleaning. It's about an experience. It's about quality of life. And this is really about increasing quality of life because certainly you could throw a bath chair down, you could get a thing and you could hit somebody with water. That's not the same experience that we're talking about here. And I think that, for a lot of us, you brought up a great point. When I'm looking at putting a family member in a long-term care facility, the amenities and the experience and the level of patient care that my mom or my dad or my family member is going to get is going to be a huge influence on making that decision. At some point, the funds of what it's going to cost are going to balance out. But these are the kind of things here where you're really providing a very high level of quality of life experience. I do want to just get back to kind of something we were talking about earlier. Now we've got these three models, the Berkeley, the Colorado, and the Meramec. I'm glad that you brought up that they do have space underneath those for Hoyers. So immediately you get somebody out of bed, they're in a Hoyer, you can easily bring them into this tub. As a caregiver, the controls are going to be very easily accessible. You're not going to worry about the water settings. They're going to automatically get to a point where you're never going to make it too hot. And so, all these safety features that we touched on earlier now really come home because, the caregiver and the person that's going to be assisting, their experience is also important, and making it easy for them so that the person actually inside also gets the best quality experience. Now, these tubs that we've got here, these could be used then for people that are still mobile. These could be used for people with walkers. And obviously, you've already addressed it. These can also be for people immobile that'll come in and bathe in a sling.
Correct. Yes.
And so walk us through these three models here and tell us what the features are. They're going to give us a little bit a different, a little bit. I can see that there's different places where the controls are, but give us a little bit of a breakdown on what the difference will be between a Berkeley, a Colorado, and a Meramec.
Okay, so the Meramec design is basically the interior of all the tubs is the same. The door is basically the same, but it's the placement of the controls and also the design of the final shell. So the Meramec on the far right would fit into a standard 60-inch alcove. So if I were to put this into my home, if I can get it into the room, it would fit in the same opening that my normal bathtub used to fit in, right? So again, not a lot of modifications would have to be done on this tub. It's designed to slide into that alcove. And so it makes it a little, you're envisioning it right now because it's kind of squared on the side, so it doesn't quite look as attractive as the Berkeley and Colorado. But once it was slid into that alcove, then it changes the whole look because then the walls are finished around it. So that's a little misleading on this particular look just because of that. The disinfecting is at the top, so that increases the size of where the control panel is, just again for accessibility to that. Okay, the Colorado, this one I it's one of my favorite from the standpoint of if I want to promote some independent bathing as well as caregiver provided bathing within my facility, this is great because let's say Betty still is, pretty spry, her faculties are really, really good. And, I'm not going to leave her alone in that bathing room. But maybe when it comes to Betty's bath, Betty gets to turn on the valves. Betty gets to fill her own bath. Betty gets to, enjoy that experience. I'm there to support her in any way I need to, but yet just think of that. Now she can get in and out of the bathtub by herself. She can bathe herself and she can run the controls. I mean, perfect situation there. But also, I can still operate these controls. I can reach across, and so I can accommodate again several different levels of care within my own facility. And each individual can be treated as that individual that they should be treated as and the capabilities they have. And the Berkeley, probably our number one, again, mainly because the caregiver controls are at an end where I can operate the tub, but I can always have that one-on-one, that look, that conversation, that, that comfort that I, as the caregiver, provide this individual that's getting the bath. So, yeah.
Diane, just sorry, I just want to jump in, and I think when you look at these tubs, size and weight, and understanding on how people position in them, I think the Meramec has a bigger seat, right? Or the wider seat.
It's a little wider, yes.
So
yes.
just wanted to touch on that for a minute.
Yeah, it's a little wider seat, same form, but it is wider. But all of these units do have a 600 weight pound capacity. So they're all classified bariatric bathing. But yet a person, 150 pound is going to feel very comfortable in there as well. It's not like they're going to be, it just gives me a little more room than maybe I need, but it will still accommodate a lot larger individuals. Correct.
Diane, you talked about different types of doors. There's inner opening and outer opening doors?
So the inward.
Yeah, go ahead.
Okay, so the inward swing doors are designed more for the walk-in tubs. And that again is the ones where I'm literally going to step over a 3 to 4, 5-inch threshold. Again, significantly smaller step than getting into a normal bathtub. I will get into the bath, I will close the door, I will sit down, and then I'll begin to fill the bath. They're really good in smaller, tighter spaces. When you're talking your home, and we talk about door openings as well as hallways. How do I get this bathing unit into the house, right? So I need to be able to make sure I can get it into the location I want it to do. So if it's an older home, let's say my door openings are only 30 inches. I am limited to that 30-inch door opening. And so a lot of our inward swing doors will accommodate that. Not all, but some. If it's a 32-inch door opening, we have different units that would accommodate that. So again, it's a matter of determining what environment we're going into, what we're trying to accomplish with the bath that you'll be acquiring, and then determining this is your best solution. And if today I'm still mobile, but my doctor's telling me because of circulation issues or something like that, 4 years down the road, I will either be using a walker or a wheelchair. That might determine or influence which model. An inward swing door, you're not going to do a slide transfer from a wheelchair. But an outward swing door, every model we have, you could do a slide transfer. And so those are things we would want to consider. So a lot of it's in asking the right questions, asking what outcomes they want, and assisting them in directing them with the choices that would, with the products that would best fill their needs.
I think we've done a great job today addressing some of the basic starter questions that everybody has. And if you like this video, subscribe and share, because we've got more information that we're going to present. And Diane and Josh and Peter, thank you so much. I think, the initial call today of talking about what are the safety features, what are the types of tubs and walk-in tubs and different types and different scenarios is a great way to get this format started. So I'm super grateful, Diane, for your time. One thing also, I just have to throw in, Josh and Peter, made in America. We're talking about a really high quality product Drive is providing. This is a made in America product, super high quality warranty. You're getting the best of the best from people in the beautiful state of Tennessee making these every day and showing up and putting that quality work into all these products and the design. And as we've talked about, the upgrades and features and the modifications that keep going as you become an expert in this industry. So with that, all that being said, if anybody has any questions or any last words they want to throw in, go ahead. Josh, you have anything you want to end off with?
Sean, you had me at the introductory. Pleasure to be here. Look forward, obviously, to the next set in the series, and supporting you as always. So,
you guys are awesome. Peter, anything, sir, you'd like to say before we call it our first segment here?
No, I think we hit it. I think just like we said, it's really a lifestyle improvement for the home and for facilities. This is just a great branding piece. This is a marketing piece for them to show like how they, can pull in patients and differentiate themselves.
Yeah, and Diane, you're amazing. And once again, this is about providing the highest level of patient care for your loved ones. This is about keeping mom at home, keeping dad at home. This is about overcoming challenges that you have with home care, giving the extra quality of life that we want to our loved ones. And so for somebody like myself that's new in this industry, these are great segments because it's the educational process that helps us make the decisions on getting the products that's best for us. And I greatly appreciate everybody's time today. Thank you so much. I'm going to look forward to seeing you again next week, same time, same place for more information. Stay with me. I'm going to put this on pause and then we'll connect again here soon. Thanks, everybody.
Thank you.
Thank you.